we did was the metatarsal arch, horizontal abduction, horizontal abduction. So now if we want to go into the hallux and the phalanges, okay? So what is the problem that many people have with hallux? With the hallux? So you named a lot of things. People get metatarsalgia, okay, which is not part of the hallux. Okay, so people do get metatarsalgia, and that is pain at the metatarsals. It's usually at the head of the metatarsals, and very often when people have metatarsalgia, they have a dropped metatarsal arch. So they go like this, and they're generally weight-bearing on the head of the first metatarsal, and very not the first, the second, and they'll get a callus here. Okay. Yes.
Gout?
Gout? Okay. What? No. Oh, splayfoot. Splayfoot is, they have a very wide metatarsal arch, but it's not necessarily reversed. Gout, you do get crystalline arthropathies at the MTP joint, and that can be very, very painful, but, and it can cause a rigid hallux because it's very painful, okay? But gout essentially is going to be treated pharmacologically, and then what we treat is the residual of what happens because they've gotten really tight. But the most common thing that you see is hallux valgus, which is the MTP and sometimes the IP joint being pulled into a valgus position relative to where it should be, which is in line. When that happens, that usually happens very often when people hyperpronate, when they overpronate. So what happens is they start to bear weight on the outer edge of the metatarsal phalangeal joint rather than at the ball of the foot, okay? So basically it's pointing that way. And a lot of times the reason that that happens, the most common reason is congenital. Usually if your mama had it and your papa had it, you're going to have it. They used to say it was from wearing tight, pointy shoes, and that probably pushes it along a little bit. So shoes that you wear should have enough toe wiggle room and should have a high toe box and should not be pointy. You know, your toes don't come together like that. But even if you wear the best of shoes, the most fitting shoes, congenitally, if your genetics say you're going to get into a valgus position, you may get into a valgus position, you probably will, but it may not be as bad if you're wearing better type of shoes. So what you want to do first is when you're looking at valgus, when you're looking at mobilizing the toe, the big toe, you want to think about which movement. I'm not talking about hallux valgus now, just talking about big toe in general. Which movement do you want to ensure they have maximum of?
Extension.
Extension, okay, that way, okay? Extension is towards the dorsum of the foot. So what you need to do is you need to find the joint line. And again, it's like the fingers, it's always more proximal than you think it is. Stabilize the first metatarsal here, and then in which direction am I going to mobilize to increase extension? Dorsal. What is it? Concave on convex? Okay, so it's going to go dorsal. Okay, so like the fingers, I do a little bit of a distraction, just a piccolo distraction. distraction just to release the surface tension. And then I'm going to use my thumb to glide dorsally. Okay? Like that. And I'm going to be in grade 4 or grade 3. Okay? So then I want to take him to the end of his range. Okay. A little bit of a distraction and dorsal glide. You okay, Doug? Okay, and then end of his range, distract, a little bit of a distraction, dorsal glide. Okay, so you want to increase extension. That's the most important thing. Okay, flexion is nice. So if they have limited flexion, you do the same neutral, start with a distraction, a little bit, and then you can use the side of your index finger to glide planter. Okay. Just remember your semantics. Going into extension is a dorsal glide. If you're going to call it anterior or posterior, what are you calling it? Anterior, because this is the anterior surface. Okay, so if you go into, now, the toes are like the fingers, concave and convex. In the fingers, if you want to increase extension, you do a dorsal glide or posterior glide. In the toes, if you want to increase extension, it's called an anterior glide. So if you just call it dorsal or palmar, dorsal or plantar, you don't get confused at all. Okay? Okay, so that's dorsal and plantar. Now, when would you be mobilizing somebody's toe?
Help with push-off?
When what?
We're gonna help with push-off?
To help with push-off. So under what diagnostic or clinical conditions? Yeah, if they've been immobilized. Certainly anybody who's had their foot and or ankle in immobilization, they will need they will need their toes taken care of. And then, of course, if you have, there's also a condition called Hallux limitus or Hallux rigidus, which is basically arthritis of the hallux, where you have a limited, basically rigid means it's maybe there's very little, 3, 4, 5 degrees of flexion or extension, or limitus, if normal is 70, then limitus would be significantly less than that. So, and there's no range, it could be 10, 15, 20 degrees, okay, but it's not going to be 60 or 70. Okay, so that is dorsal and plantar, and then if you also, to improve toe mobility, especially in the MP joints, MTP joints, you can do glides in the lateral and medial directions, so just like you did in the fingers. So it's medial lateral glides and medial lateral tilts. So with the glide, you're going to stabilize the metatarsal, get your hand right into the web space as much as you can. Okay, a little teeny bit of distraction to decrease the surface tension. Glide laterally, medially. Laterally, medially. Okay. Now, if you had somebody who had Hallux valgus, okay, you don't really want to be doing a glide towards the lateral part of the foot, so you're going to do only glides towards the medial part of the foot. Now, again, just to make things interesting, I'm calling medial the medial part of the foot, and lateral, the lateral part of the foot. But the foot like the hand, the toe, the middle toe, the third toe is the midline. So you might see it written the other way, because if I'm gliding to the medial side of the foot, some people will call it a lateral glide. So just glide away from the valgus. Okay? And then there are, I can't think of any time when I would glide towards the lateral part of the foot, because you never get a hallux varus. It's always a valgus. Okay? And then you can do the same thing with the other toes. Little distraction, lateral and medial glides, lateral medial glides, lateral medial glides. Okay? Then you can also do tilts, and this is important because you have hallux valgus, so and that would be a tilt in the valgus direction. You don't want to do that. You can stabilize the metatarsal, and you're going to kind of do a push-pull, pushing your thumb towards the lateral side of the foot and pulling the phalanx towards the medial side. In other words, you're moving it from valgus, you're moving it towards varus. Okay? And that, with a little bit of a distraction. Now, when you have somebody who has a lot of hallux valgus, you have to do this, think grade 1. You're still taking them to the end of the range, but it has to be very gentle. Okay? If you have somebody who has a hallux valgus and you want to increase extension and flexion, I will always tilt them to neutral, keep them in neutral, and then do my mold into extension, okay? Because there's no sense in mobilizing from the valgus position, okay? And a lot of times what you want to do is a lot of distraction at the lesser toes, and people who've had their feet immobilized, all of this is really tight. And guess what? Nobody pays attention to the toes. We're all stuck on thinking about subtalar and talar crural. Whereas the toes, it's very important because the toes play a very significant role in your balance mechanism. So if your toes are not loose, you can't use your intrinsics for your balance. Okay. So towel scrunches as exercise, picking up marbles with your towel, etc., just to get the toes moving. Okay.